Hi, I'm Dr. Ardhanari. I'm a psychiatrist from Tamil Nadu. I would like to share a very disturbing and rather disgusting incident that one of my colleagues shared with me recently. So, this colleague of mine, she is a female sexologist who has finished her MBBS, MD, and then she has finished her psychosexual medicine fellowship, and she's a practicing sexologist. So, what happened one fine day, one of the patients sent her a WhatsApp message asking for an appointment at very odd hours in the night. So, she had asked him to come the next day in person to meet him in the clinic and seek professional advice. This particular person had immediately sent a nude photograph of his private parts to her and then was trying to ask something in a flirtatious way, in a very indecent way. Immediately, this doctor had to block that particular person and report him. But what I would like to ask in this incident is that what rights do you have to send such a thing to a doctor? Do you think that you can do whatever you want just because somebody is willing to help you at odd hours? Do you think that you can take advantage of a female sexologist just because you can come and then talk openly about all the perversions that you have? This is literally digital abuse and this is harassment against one female person. And this cannot be tolerated when it happens even to a male sexologist. And this is something which is not spoken in our country. See, we need to understand that in a country like India, where already talking about sex topics is a big taboo and it is very difficult for us to find genuine people who are giving genuine advices. And so in a country which is already having so much of lack, if you people keep abusing people who are voluntarily trying to help you, bring you out of your condition, what kind of mentality do you people have towards doctors? This is totally not acceptable. A person who is a sexologist will be open to receive your complaints, receive your problems. Does not mean that you can sit and then flirt with them. Just because they are open about all your sexual problems, you cannot take advantage of that person. They start flirting, they start asking about the doctor's private life and sexual life. Who gave you all these rights to ask about another person's private life when you are not a professional? What you're doing is just abuse of doctors, and this has to be condemned. There is a lot of infertility cases, there are a lot of performance anxiety in case of men, there are a lot of vaginismus cases that we see who are genuinely having these problems and not able to find the appropriate person because there is a lot of hesitation from the medical fraternity also to address these kind of topics because of all this nonsensical hindrance that we get. It is important for you to maintain some discipline, decorum, and decency and basic dignity when you go and then approach a doctor. Of course, people with genuine problems will not have a lot of these kind of idiotic, arrogant behavior. But unfortunately, we come across a lot of perverts who try to use this digital format in a very unpleasant way. How far will you go? You started blaming doctors, you started litigating doctors, you started hitting doctors, and you started, sexually assaulting and killing doctors. What else do you want to do? You please put an end to it. And it is our responsibility to create a responsible and decent environment and the society. People who are like this has to stop what they are doing, and they may have to face consequences for all the actions that they do wrong. So I hope that general people who are seeing this take it in a positive way and then support the doctors who are genuinely helping them and always stand against people who are abusing us. Thank you.